Hello, my name is Michelle Kirsten. I'm a student nurse at MCC, and today we're going to talk about the diagnosis of preeclampsia. All of you have a preeclampsia warning sign test, pre-test. If you would, please circle what you know about preeclampsia warning signs, and then we'll talk about it. Okay. Preeclampsia is defined by the American College of Obstetricians and Gynecologists Task Force on Hypertension and Pregnancy. Is defined as a complex, progressive, multi-system disorder of pregnancy that can present in many forms. Some women present with a hypertension that they did not have prior to pregnancy, and some women have no symptoms at all. Before their prenatal visits determine that they do have hypertension or maybe protein in their urine. The actual diagnosis is having a systolic blood pressure above 160 or a diastolic blood pressure above 110 on two different occasions, at least 4 hours apart in a patient on bed rest. So that's why if you do have high blood pressure at your prenatal visit, that's why they send you to the hospital so that you can do the 4-hour test to monitor your blood pressure. Or severe and persistent right upper quadrant or epigastric pain that does not resolve with medication is not explained with another diagnosis. A lot of times women think that that pain might be heartburn because it is here or here. Basically how it affects the mom is the placenta provides the primary source of sustenance to the growing baby throughout the pregnancy. It provides oxygen and nutrition to the baby, and it also removes waste from the baby. Due to the preeclampsia, the maternal uterine spiral arteries are impaired, resulting in reduced perfusion that triggers an inflammatory response and results in maternal hypertension. There are a lot of warning signs of preeclampsia, and these are things that we're going to contact our healthcare provider with every time, no matter what time of day or night that they present. If you have a severe headache, right upper quadrant pain, epigastric pain, visual changes like a loss of field of visions or seeing spots, difficulty breathing, swelling of the face or hands, weight gain of more than 3 to 5 pounds in a week, or high blood pressure, and that limit is going to be set by your provider. It depends on where you are now of where they're going to want you to contact them. Preeclampsia is 140, and severe is, and eclampsia is actually 160. But I left that blank on your form because I want you to contact your healthcare provider and ask them what number they would like for you to contact them at. So there's many ways that we can manage the diagnosis of preeclampsia, and the two big ones are managing your blood pressure and managing your stress level, which we know affects your blood pressure. So a couple of things we can do to manage our blood pressure is a high protein, low salt, low fat diet. I've given you a copy of the DASH diet and for your use. And basically, they want you to have 2 to 3 cups of fat-free or low-fat milk a day, 2 to 2.5 cups of fruit daily, vegetables 2 to 2.5 cups, whole grains, daily goal is 6 to 8 ounces, lean meat, fish, poultry, daily goal is 6 ounces or less, nuts, seeds, weekly goal is 4 to 5 times a week, and your oils daily goal is used sparingly. In addition to the DASH diet that I'm giving you a copy of, they recommend that you have a low sodium diet, and there is a DASH low sodium diet that recommends less than 1,500 milligrams of salt a day. We want you to drink 2 to 3 liters of water a day, exercise 30 minutes a day. Of course, hopefully you're not doing alcohol, caffeine, and nicotine. Identify a stressful situation and make plans to avoid them. Avoid hot water baths or sauna, and take prescriptions as ordered. In addition to these things to manage your blood pressure, you're going to manage your stress level. You're going to get at least 8 hours of sleep. You're going to lower your work hours if possible, maybe lower your work hours per day, or arrange to have a couple of days off a week. Just say no, which is really hard during the holidays, with all the social demands and family demands during the holidays. But delegate some of your obligations to other people and really try to focus on you and the baby right now. Meditate or do yoga. You can actually do some visual vacations. Unplug your phone or TV if those things are stressful to you, and listen to some music. Do some deep breathing. Enjoy a visit with your friend, your best friend, or your mother. Get a massage, manicure, pedicure, and dream of your new baby. Basically, anything that we can do to lower your blood pressure, which relieving stress and managing your blood pressure helps the mother and the baby. Some things that we can do, expect before delivery is they're going to have close maternal and fetal monitoring throughout the pregnancy. They're going to also check urine for protein, and they're going to really check those labs to see how they need to manage the diagnosis of preeclampsia. They're doing fetal non-stress testing on the baby to determine the oxygenation, and also to get a good gestational age for the baby, because the only resolution of preeclampsia is actually having the baby. Most babies, of mothers that are preeclamptic or eclamptic, are born preterm. And so they're figuring out when's the best time to have the baby. And most babies are obviously delivered by C-section. So you also want to figure out your maternity leave. Plan on having a preterm baby. Have it early. Coordinate with work, family medical leave for your spouse, finances, and of course all of our nesting that we do before we have a baby, bring home a baby. Discuss with your healthcare provider if the facility that you're going to deliver at has sufficient neonatal facilities, and if not, talk about an alternate location for delivery. And most expectant mothers have a natal plan or a birth plan for delivering it naturally, natural childbirth, but go ahead and make an alternate C-section delivery plan. I've got here what you should do to be, if what should you do if you're put on bed rest. I've got that in the brochure here. That's if we can't control the hypertension, then the last resort before actually delivering the baby is to be put on bed rest. After delivery, you can expect to have a premature baby. You're going to have one-on-one nurse ratio, so only expect one other person, one support person in the room with you during the delivery. They're going to closely monitor the mother for hemolysis, elevated liver enzymes, and low platelet, which is HELLP syndrome. It is the worst case scenario, and it actually is the reason that people with a preeclampsia, although 2.3 to 3.8% of pregnancies develop preeclampsia, 14% worldwide is the result of maternal deaths, and that's because of the HELLP syndrome. That's a rare occurrence where the mother's red blood cells are damaged due to narrowed vessels resulting in lower red blood cells and platelet count. And this damage can lead to hemorrhagic necrosis. Since preeclampsia is a risk factor for cardiovascular disease, mothers will have long-term cardiovascular assessment long-term after delivery. Okay, so let's go back over our high-risk warning signs. Can anybody tell me what the high-risk warning signs are for preeclampsia and when we should call our healthcare provider?
Severe headache.
Okay.
High blood pressure that your doctor's going to tell you what numbers to call if you're at.
Swelling of the face or sweating in general.
Right. The big two would be the severe headache and the right upper quadrant pain. Of course, if you're gaining over 3 to 5 pounds a week, that would be a sign too. And I have them listed here for you in the brochure. It talks about everything that we talked about today, plus the warning signs, and your healthcare provider's name, phone number, and after hours number. Just hang this on your refrigerator so that you can have it accessible at all times. All right, as far as our diet, which that we know that a low salt diet lowers our blood pressure. Can you tell me how much salt we're supposed to consume less than a day?
Less than 1,500 milligrams.
Okay. And how many serving or cups of vegetables and fruit are we supposed to consume a day?
2 to 2.5.
All right. And last but not least, during the holidays, how can we manage our stress?
Get enough sleep, like 8 hours of sleep.
Okay.
Stay at home, no partying.
Okay. Just say no. Just say no to some of those family and, delegate some of your responsibility to other family members. Okay. Any questions that you have?
Why is a sauna not recommended?
Because hot water, sauna, hot baths, and saunas raise your blood pressure.
It would seem like it would be different, like it would dilate your blood vessels and lower it, but,
It raises your blood pressure.
oh, okay, okay.
Besides, I don't recommend that for pregnant women anyway.
Okay.
Any other questions?
Does insomnia come with this? Laying in a hard sleep? Okay.
No, I think that comes with pregnancy in general, but not necessarily
Well, yeah,
preeclampsia. Yeah.
I'm sure it's different.
Okay. All right. That concludes our class, and thank you all for attending.
Thank you. Till we make it.